see about the dural fold or dural septas. So actually the dural matter is having two layers, that is outer interstitial and the inner meningeal layer. The inner meningeal layer will again be infolded such that it forms a dural fold, and the four most important dural folds are being discussed here. The first thing will be falx cerebri. The falx cerebri, from this figure we can understand that it is a vertical fold, and it will be enclosing it will be found between the cerebrum, and it will be dividing the whole cerebrum into right and left cerebral hemispheres. And the thing is, it is sickle shaped, and the other thing is about the attachment. It is having an anterior, posterior, superior, inferior attachment. Anteriorly to the crista galli, posteriorly to the tendorum cerebelli, superiorly it will be to the vault of the skull, and inferiorly the margin is free. And the next thing is about the sinus that is enclosed within the falx cerebri. They are superior sagittal, inferior sagittal, and straight sinus. Next thing will be tendorum cerebelli. As the name suggests, it is tent shaped, and it is seen between the cerebrum and the cerebellum. To say specifically, it is seen between the occipital lobe of the cerebrum and the cerebellum as a whole, and it will prevent or resist the compression caused by the cerebrum onto the cerebellum. And next thing is, it is having an inner free and an outer attached. The inner free will be enclosing the tentorial notch, and the outer attached will be into the it will be attached to the temporal bone, the petrous part of the temporal bone, and the posterior clinoid process. Next thing is is that about the sinus that is enclosed. There are two in number: transverse sinus and superior petrosal sinus. Next thing is a falx cerebelli. It is also sickle shaped, and the thing is, it is seen between the two cerebellar hemispheres. Just like the cerebri, it is between the two which is between two cerebrum. The cerebella is between two cerebellum. Next thing is, it is attached to the attachment is into the internal occipital protuberance, and the sinus which is enclosed is occipital sinus. Next thing is diaphragma celli. It is very small, a circular fold. It is covering, or it is roofing over the pituitary fossa, and it is having a small aperture for the passage of stalk of the pituitary gland. And next thing, this table shows the shape and the venous sinus enclosed by the various folds of durameter. And the arterial supply and the nerve supply. Arterial supply is mainly by the internal carotid, ascending pharyngeal, maxillary. A branch of the maxillary named middle meningeal artery is a very important clinical significance, because if anything happen to the artery at the site of pterion, it can cause extradural hematoma. It is very important. Next thing is nerve supply. It is by trigeminal and the cervical spinal nerves and cervical sympathetic trunks. These are the nerve supply. Referred pain means if anything happened to the dural fold, the pain can be referred. If supratentorial dura gets affected, it will be referred to the forehead. If infratentorial, then it will be referred to the back and the occiput.